Though Malawi has been registering cases of trafficking in persons, a number of prevention and mitigation measures were put in place so as to make sure that people are safe and that the victims of trafficking in persons have been rescued and received the utmost care and support. Trafficked persons tend to have immediate medical needs which need to be addressed as a first concern. As so, Beth Israel Safe Home conducted a one-day training and orientation on trafficking in persons for health workers at Capital Hotel in Lilongwe.
As you know, when somebody has been trafficked in, she or he will have a lot of problems, and especially the psychological one. So as health personnel, we do our risk assessment to assess the individual if he or she has got any health-related issues. So if he or she has got any health-related issues, we will need to acquire the health expertise to assist us. As we all know that in health, it's not everything that you know, but you are supposed to refer to your friends. So we have organized this training for us to coordinate with our friends from KCH so that they should also assist us in so many health-related problems that these TIP people are facing.
The main goal of the training was improved capacity and understanding of medical and health needs that are associated with victims of trafficking in persons by health and medical officials. The orientation targeted different officers from various departments at Kamuzu Central Hospital, such include mental health officers. In her opening remarks, the chairperson of Gateway of Hope, Mrs. Christian Kachimanga, said Beth Israel Safe Home was established to provide services to victims of human trafficking.
Those who have been rescued or are on the run from the traffickers require special protective services while receiving treatment in an environment that could be accepted by the victims as friendly and trusted. Hence the importance of having Beth Israel Safe Home. The Safe Home is established to provide transit accommodation to the victims who need much needed protection, medical care and assistance as required by the Trafficking in Persons Act of 2015. Providing this much needed support, care and protection of victims remains one of the biggest gaps and challenges being encountered by the law enforcement officers in their day-to-day discharging of duties related to trafficking in persons offenses, hence our selfless work and support in our respective capacities to help in the fight against this modern-day slavery, including but not limited to raising massive awareness among Malawians. It is therefore with great pleasure and honor that I welcome you to Beth Israel Safe Home, a home established to rescue the weak and the needy, deliver them from the hand of the wicked, as it has been commanded by God in Psalm 82, verse 4. The Beth Israel team recognizes that combating trafficking in persons requires the concerted efforts of various stakeholders of different disciplines. It cannot be tackled by any single party or from any single perspective. Due to the complexity of the vice, we must recognize that it is only with concerted efforts that we can register significant strides in the fight against trafficking in persons in Malawi.
Minister of Gender, Social Welfare and Community Development, Honorable Patricia Kaliati, officially opened the training.
In recognition to the need for national guidance, Government of Malawi, under the leadership of His Excellency the State President, Dr. Lazarus Chakwera, and also the Vice President, Dr. Sausilima, they are pleased that the management of Beth Israel Safe Home, Gateway of Hope, organizes this first training for health workers since the enactment of the law in 2015. And on behalf of the Minister of Home Affairs and Minister of Health, I would like to thank you very much. And I am here just to show the coordination which is between or among the three ministers, the Minister of Gender, Minister of Home Affairs, and the Minister of Health. The Minister is therefore happy that you could find time to attend this important training. And also today's event is a unique opportunity for us to inspire medical and health workers to join the government of Malawi in providing services to trafficking in persons. We believe that as a nation, we need to adopt a common approach to address common challenges as our basic tenets of bilateral relationship required to adequately implement the Trafficking in Persons Act. I would like to thank His Excellency Nia Gesh and also family for the support provided through Beth Israel Safe Home managed by Gateway of Hope team, and also first most important provided for this training workshop. I would like also to thank Mr. Matewere and also the UN ODC for the support and also the training skills which you are going to impart in our officers present this morning. With this, allow me to officially open the training workshop for our health workers who are going to be trained into the support of our persons in those who've been trafficked. May God remember you and have a blessed day throughout the training. Thanks so much.
During the day, participants were taken into a number of presentations for medical health officers to understand trafficking in persons and the need for medical and health assistance for trafficking in persons victims. Mr. Kundwani Kamanga from the Ministry of Homeland Security took time to orient the medical and health officers on the national and international legal framework on trafficking in persons and standard operating procedures. His presentation tackled a number of issues such as the provision of medical services on the Trafficking in Persons Act 2015.
Sometimes when someone has come to say ndufuna medical certificate, you can't just issue a medical certificate without proper diagnosis and examination of the case, not? Because sometimes if you just issue that particular certificate without finding out what is the real problem, you might be abandoning the issues of human trafficking. Under Section 45, subsection 1 of the Trafficking Persons Act, there is a provision that we must designate certain premises as shelters for victims of human trafficking. And in compliance with that particular law, the Gateway of Hope, they have decided to designate one of their premises to be a shelter for human trafficking. But if you look at the consequences of human trafficking, some of them, they become ill in the process. They will need psychosocial counseling. They will need medical help. And the only institution that is responsible and trusted to provide medical services is the hospitals, not so. That's why they saw it very much important that there must be a linkage between the shelter owners vis-a-vis where they can seek services.
For the medical and health officers to understand why they are major stakeholders rescuing and assisting the victims of human trafficking, Maxwell Matewere made another presentation on the role of medical and health service providers on trafficking in persons. The presentation discussed how medical or health workers can identify a victim of human trafficking within the hospital. It also further discussed the techniques to rescue the victims. After the training, participants admitted that there's indeed a knowledge gap amongst the health workers on issues of human trafficking.
After the training, I've noted that there was really a huge gap that was there between the victims of human trafficking and the healthcare workers, mainly because we did not know how to take care of them and in what ways we would help them. We would help them, but not knowing that maybe they have been trafficked. But now our eyes have been opened where we'll be able to at least identify those people that are the victims and even help them accordingly and know where to report and how to follow them up.
I feel ashamed to a certain extent because having worked for more than a decade in a health system, I can recall that I was able to encounter such kind of cases, but it never linked a bell in my mind. So to a certain extent, I would say I'm ashamed, but now with the training, I'm so happy that I think I'll make a difference whenever I encounter such kind of a case.
The participants promised to share the notes with their colleagues in various departments within Kamazu Central Hospital and share responsibilities on how to identify and treat the victims of human trafficking.
So from here, in our various departments, because there were different departments that came in, we had those that look at adult medicine, those that look at child health, those that look at mental health, those that look at people that have been sodomized or that have been raped. But so in that way, when we go out there, we're going to share the information to those that did not come on how we're going to be handling such cases. So the issue is not ending here. The information is not ending here. In our various departments, we're going to hold various meetings to see how we're going to be helping the victims in one way or another.
The issues of human trafficking is getting worse, and there's need for the government of Malawi, UN agencies, non-governmental organizations, community gatekeepers and other stakeholders to work together in the fight against human trafficking.